you mind telling us a little bit about your background and what brought you to this point? Why acupuncture?
That's a very good question. Actually, in my first career, I was an engineer.
Ah.
So I got my bachelor's degree from the University of Minnesota and graduated with highest honors there. And really loved the schooling. And once I got into practice, I hated it. I just was not cut out to be an engineer. And so after working for a couple of years, since I was in the wrong field, I developed a lot of stress-related illness from it. And so one of my friends was seeing an acupuncturist, and I just thought, hey, I'll go try it out. I'll see what this is all about, see if she can help me at all. And I was completely blown away. Like, I couldn't believe what this woman could help me with. And my doctor put me on medications, and I didn't know when I would get to go off of them. Like, do I have to take this forever? That sort of thing. And the acupuncture was actually able to heal the problems that I was having, so I could go off the medications, feel better than I had even when I was on them. And so I was completely blown away. I thought, this woman knows these things that, the medical community doesn't know, that they don't understand. And I thought that was really the wave of the future for healthcare. Yeah, so I decided to go back, and I got my master's degree in Oriental medicine and opened up my own practice.
And I understand that your focus is really on digestive issues as well.
Yeah, I would say I treat a lot of digestive issues and internal medicine. So digestive issues, anything from stomach pain to bowel problems, to reflux, to ulcers, those sorts of things. And then other things that can be related to that as well, and other internal disorders. So you might have allergies or asthma, headaches, menstrual problems, insomnia, any of those things I can help with as well.
So now your clients, I'm guessing, are coming to you for a lot of digestive issues and things like that, since that's what you specialize in. But that's not the only thing that acupuncture helps with. And you did touch on a few things such as allergies and asthma. What does acupuncture help with?
Acupuncture can help with just about anything. It's really amazing, and a lot of people say that, but it's true. There are so many things that acupuncture can help with. Like the most common thing that people seek it out for is pain. Just because that's what a lot of the research has been done on. More medical doctors know about the use of acupuncture for pain. It's more well studied and more well proven. So whether that's back pain or neck pain or headaches or whatever, knee pain, all of those things. Also menstrual and women's issues. So if women are having PMS, they're going through menopause and having trouble, if they're struggling with infertility, any of those issues can be resolved quite effectively with acupuncture and herbal medicine. And then also emotional issues. So if people are struggling with depression or anxiety or bipolar issues, addiction even, acupuncture can be very helpful for breaking the cycles of addiction and helping to either uplift the spirit or calm the spirit or whatever somebody might need.
Wow, and a moment ago you said something about, there are a lot of things that acupuncture can do that the medical community, traditional Western medicine, can't do. What are some of those things?
Well, for instance, if you're having back pain or shoulder pain of some kind, the tools that your doctor has tends to be either drugs or surgery. So if somebody wants to fix their upper back because they're having a lot of tension, well, their doctor isn't going to be able to help them. They're going to say, here, take this drug, or we'll give you a cortisone injection, but it's not really going to fix the problem. And so they're really limited in their tools, so they don't really know what else they can do to help. And also, like with digestive issues, since that's one of my areas of specialty, there really aren't a lot of medications that are really effective for digestive issues.
Oh, okay.
I mean, actually the most commonly prescribed drugs are acid blockers, are things like Prilosec and Prevacid. But those are really they're decreasing the amount of acid in your stomach, but they're not really fixing the underlying problem. And with acid blockers, like, they were really only meant to be taken for about 6 months. So they were really meant to be taken for a short amount of time to give your stomach a little bit of a rest. And then you go off of them and give your body a chance to bounce back. But a lot of people are taking these for years and years and years, and it's not fixing the problem. So for instance, if you have reflux, I mean, it's not helping. Your reflux is when your lower esophageal sphincter can't close all the way. Well, if you cut down the acid, you're not changing the esophageal sphincter, you're just changing the way your digestion is working. And so it's not really fixing the problem, whereas with acupuncture, we can actually stimulate that sphincter and help it to regain its muscle control again. And then on top of that, most medical doctors also don't have training in nutrition. My husband's an emergency medicine doctor, so I was with him all through medical school, and guess how many nutrition classes he had? 0.
Zero?
He had 0.
Oh my
He had
gosh.
no training in nutrition. So unless a doctor is getting advanced training in nutrition, they're not really well equipped to help you with your diet or even to help you with foods that will heal. And that's something that Chinese medicine does very well, and that's one of my areas of expertise as well, is Chinese medicine food therapy, where you're looking at, okay, well, what foods are you eating that are harmful? So for instance, like for reflux, like obviously you don't want to be eating as much acidic food, but there's other foods that can be problematic as well. You know, things that are going to be hot in nature, that are going to heat you up, things that will basically irritate your stomach lining as well, whether that's, you know, vinegar or spicy food, or alcohol even is very common. It can exacerbate reflux. But then, you know, most Americans focus on what they shouldn't eat, but I think what's more important is what you should be eating. It's like, you can't just have a list of everything you need to cut out, because then pretty soon you're living on like rice and vegetables, and that's not realistic. But if you can include foods that will help you, so for instance, for reflux, or if you have heartburn, those sorts of things, it's very helpful to eat celery and lettuce and cucumbers. They'll kind of cool your stomach down, soothe things a little bit. The cucumber, if your mouth is really dry, will give you a little bit of extra fluid. So, you know, knowing those healing properties of food is really helpful.
Now, you mentioned the heating and cooling effects of food. Can you talk a little bit about Chinese medicine and how it's sort of structured? I know that there's hot, cold, dry, damp, and could you talk a little bit about that? Because that's a lot of terminology that people will hear in an acupuncture session that we might not be familiar with.
Right, exactly. Well, in Chinese medicine, what we're attempting to do is we're trying to restore balance to the body. So the first thing to do is to find where that imbalance is. So the diagnosis methods that were used, because this medicine is 3,000 years old, probably even older than that. You know, so the way that the Chinese developed it was they were really good observers. And so they had to, you know, they didn't have blood pressure cuffs and MRIs and blood tests and all of those things to diagnose somebody. So they had to come up with a system to, you know, to be able to describe what was happening. So what we look for then are general overall patterns that are showing up in somebody's body. So, you know, that pattern may be of heat or cold. It may be dryness or dampness. There's too much fluid. There's too little fluid. And by doing that, it ends up being very holistic, where you can link a lot of things together that don't really seem to be related. So, for instance, you might have a digestive problem. Well, that might be very related to the headaches you're having. It's absolutely related to the allergies you're having. It can also be causing you to have additional PMS symptoms that maybe you wouldn't if your digestion was more balanced. So we kind of look at some patterns that are showing up in somebody's body, and then once we identify those patterns, then we want to basically bring them back to balance. So again, coming back to hot and cold, if somebody is hot, what do we want to do?
Cool them off.
You want to cool them off, and if somebody's cold, you want to warm them back up. We have a lot of ancient wisdom that we're relying on to diagnose somebody and to look at somebody from a completely different perspective.
And what's really fascinating, I think, about traditional Chinese medicine is that it's thousands of years old.
Right, it has a really, really long history. And in fact, in medical school, if you go to Western medical school, if you have a book that's 20 years old, they'll throw it out because it's outdated. In my schooling, yes, we used some updated books. One of the textbooks that we used for our herbal medicine was 2,000 years old.
Wow.
Chinese medicine has a rich history of passing along information and building on it over time and refining it. And so now this medicine that's been around for 3,000 years, I mean, it's basically been tried out on thousands and millions, billions of people because it's been around for so long. I mean, really, Chinese medicine is the largest clinical experiment on earth.
Wow, and so it really is it is a holistic approach to health. And that's really what our show is about, is to help people understand the different ways that you can achieve that with the different modalities. So acupuncture is really a wonderful way to help maintain your health. So when you're not so sick that you need to go to the doctor, or so sick that Western medicine can help you, there are fantastic ways that people can achieve a state of health and enjoyment of life.
Somebody's like, well, I don't know, I just feel kind of tired, and I just feel like I have, like, I don't know, my digestion isn't working that well, and I'm not sleeping that great, but it's not like I need sleeping pills. Acupuncture can make a big difference in those cases. So I'll walk you through what to expect when you come to an acupuncturist and what sorts of things they're going to be exposing you to. So the first thing that we do in an acupuncture treatment is that we do a pretty detailed intake and history. So I'll ask a lot of questions about somebody's sleep patterns, their emotions, their digestive issues, any other problems that they might have. And the whole purpose of this is to come up with a diagnosis from a Chinese medicine perspective about what's happening and what we need to do to help rebalance the body. So in Chinese medicine, we're using a lot of different diagnostic techniques, but none of them are really high tech. So when Chinese medicine was developed thousands of years ago, they didn't have blood pressure cuffs or MRIs or blood tests. And so they had to get a lot of information from either looking at a person, smelling a person, asking them a lot of questions, and then feeling their pulse and looking at their tongue to get some objective information about what's happening in the body. So when we feel the pulse, we'll actually be feeling the pulse in 6 different positions, 3 positions on each hand. And each position corresponds with a different organ system. So each one of these positions will tell us a little something different about what's happening internally. So if there's a question that I didn't ask, or if a person didn't have a clear answer to a question, I can find out some information from their pulse as well. And then the second thing that we'll do is to look at the tongue. This is everybody's favorite part. So have you show me your tongue? Okay, great. So with our tongue, what I'm looking for is the color. Are there any tooth marks along the sides of the tongue? Are there any spots on the tongue? And looking at the coating as well. Now, same with the pulse, the tongue has different areas that correspond to different organ systems as well. Then all of that will be pulled together into the diagnosis that I come up with about what I think is happening to this patient and what we're going to do to treat it. And then once we have that diagnosis, then we're able to move into doing something to help treat that and to bring their body back to balance. So then we'll do a combination of acupuncture. And generally, when we do acupuncture, we'll select different points in the body that will help to balance out a person's condition. And then we leave the needles in for about 20 minutes and allow them to kind of do their work, and then we'll come take them out, and then we'll be done for the day.
Great. And so from the first session, do people generally get an acupuncture treatment that day, or is that first session all about intake and then?
That varies by practitioner. Most practitioners, you will get acupuncture at first treatment, right? Which I think is important, because then people can see if they like it and if it works for them, and then that also gives me some feedback when they come back the next time of how their body responded, because people will respond in different ways, and we'll fine-tune their treatment based on that.
Okay. I remember when I've been a client of Senia, so I love coming here.
Love having you.
And one of the things I remember was how thorough that first appointment really was.
Mm-hmm.
And then you gave me a report of findings that second appointment, just to go over everything that you had thought about, and you had reconsidered my case after we talked, and then you came up with this extensive list of what could be happening within my system. And we talked about it, we discussed a plan of action. So
Right.
It wasn't just a quick, here you go. It's really in depth, and it's all about it's about a plan for the future. So it's and you told me the different stages, how long you think it might take, and we adjusted that based on all sorts of different things. Time, how much time I had actually available to come in versus
Right.
how much I could actually afford to come in, and all the different pieces that you have to take into consideration. So it was just it's a really wonderful process to go through.
Yeah, well, I'm glad to hear that, because I think because Chinese medicine is so different from modern medicine, people don't really know very much about it and don't understand it. So I think it's important to take all of the information that somebody has given me in an interview, and then to come back to them with a report of findings that says, here's what I think your diagnosis is, so that you understand what I see. Because if you can see it as well, then you can start to pick it up in your daily life and say, oh wow, I know when I do this, I start to feel a little bit worse, because I know to look for this now. And then also to understand what the treatment plan typically is, because you're right. I mean, there's a lot of factors that will mix into that. Well, what time are you available, and what can you afford, and all of that, because I want to make sure that people are coming in frequently enough so that they're able to heal, but not so often that they're wasting their time. And ultimately, my goal is for people to not need me anymore. Then I know that I've done my job. And I like people to know about how long I think that will take too. I can't say, well, in 4 sessions it's going to be completely gone. But I can say, well, look, in 3 to 6 months you're going to be feeling significantly better, and here's what you should look for.